Hello and welcome back. This is Willie Martinez, and this is the third in a series of videos to educate us on healthcare reform, major medical insurance, and AWIS benefits that can help us with out-of-pocket expenses. So let's get started. We talked already about the healthcare reform facts and the federal government website. And AWIS, by the way, is a licensed and registered insurance agency in over 40 states and 2 territories. And our Association Healthcare Management, Inc., AHCM, was established in 1983 by a group of doctors to market affordable association healthcare benefits. Again, I'm the Executive Vice President of Marketing with AWIS. Been licensed for over 20 years. AWIS has an A+ rating with the Better Business Bureau, and we mostly market limited group health and dental insurance benefits through an association program that has been in business for over 30 years. Okay? Now, our association healthcare program is one of the 3 types of healthcare programs used today in our healthcare system. We already saw the videos on the government plans and private health insurance, and this third one is on association healthcare benefits, similar to programs like joining Sam's Club and Costco and AARP. Theirs can cost anywhere from $16 to $50 a year. Our association is only $12 a year for an entire family. Okay, I think that's a pretty good deal. Now, we already spoke about the 4 federal exchange plans, and we talked about major medical insurance. And we see that on the federal plans, you have these gaps over here, 60, 70, 80, 90% coverage, but you have to pay the rest. And similar to major medical deductibles, that can be a challenge, and that's where we come in. We have association plans with benefits that can help with the deductibles and your co-insurance. So with your primary insurance in place, this would be a great program to help you with your out-of-pocket expenses. This one right here is only $89 a month for a single person, $129 a month for 2 people, and $159 a month for a family. So if you saw those examples on those prices on major medical for just myself, I can go from $651 a month to $250 something dollars a month, or whatever it was, $280. Save me almost $400 a month, so I can afford this easily. And this will give me $1,000 per day in a hospital, any hospital for any reason, as long as I'm admitted as an inpatient. And does have a 12-12 pre-existing exclusion for the first 12 months. But it also pays $2,000 per day for intensive care or critical care. And it has patient advocacy, no minimum participation. If you sell it to a business with employees and employee leaves, it's fully portable. They can take it with them as long as they pay for it. And if the owner pays about half of the cost of this, it'll only be about $11 per week per employee. A great program with no health questions. So I like this plan a lot. Here's a different one that for an extra $10 a month for an individual and an extra $20 for a couple or a family, it has the same benefits, but it adds $15,000 of term life. That's regular term life, and $15,000 of accidental death and dismemberment. Again, very, very, very affordable. Now we also have another plan that's only $109. So from the original $89 for an additional $20 for an individual, okay? You can actually now add a doctor visit. If you remember that example of my Blue Cross Blue Shield, the lowest price plan with a $6,000 deductible did not include doctor visits. So this would be perfect. It's got hospitalization, but it also adds the $50 per doctor visit reimbursement, 5 times per year per family, any doctor for sickness, illness, or accident. Portable. So again, very, very affordable. And then we'll go to the last 2 plans, which are my favorite, because this is actually a much better rounded benefit if you're choosing a high deductible for major medical, and you have a $6,000 deductible if you choose that other example in Blue Cross. This is great because this plan here is only $129 for a single person, $1,000 to $2,000 a day hospital, all the other benefits. So let's say if you're in the hospital 2 days, you get at least $2,000 for the hospital stay, another $1,500 for the surgery if you had a surgery, another $300 for anesthesia, because if you have a surgery, you're going to definitely have anesthesia. And if you have any radiology imaging done there at the hospital, another $150 each. Lab and x-rays, another $50. You could be coming out here with $3,000 or $4,000 or more just for a 2-day stay. Imagine if you stood 5 or 6 days, you're looking at $5,000 or $6,000, plus the other benefits. So more than enough to help with the out-of-pocket expenses on your major medical, or your primary plan, as we should say. And then the last plan I want to share with you is probably the best one that I like so far, and to be actually to help you with your out-of-pocket expenses on your primary plans. This one includes everything, but it also adds a $50 doctor office visit. And now we have a lot more to offer here for people who choose those high deductibles, and the price here is so affordable. This for me is probably the perfect match for someone who's looking for a something to help them with out-of-pocket expenses on their primary plans. But make sure you get more detailed information from the person who invited you. We want to thank you and welcome to American Workers Insurance Services.